Welcome back. The Prime Minister has pledged to step up the pace of the vaccine rollout for residents in disability care. Joining us live now is Kate MacRae. She's the CEO at Able Australia, which is a leading provider of disability services with 43 group homes across the country. Kate, we appreciate your time. It was revealed in the last 24 hours or so that it's just 4% of residents in disability care have so far been vaccinated against COVID-19. Is it clear to you why that's the case?
No, it hasn't been made clear to us why that is the case. It's obviously very disappointing and really very concerning that the numbers are so low. 4% is obviously not an acceptable level for us to be at this point.
So in the case of the people in your care, how are people receiving the vaccine? What is the plan? I mean, have jabs been administered on site? Are people having to head off to their GP clinics? How are you going about it?
So to be part of 1A, they were really talking about a really small subsection of NDIS participants, people with disabilities who live in group homes. There are only 25,000 people living in these circumstances throughout Australia, so about 5% of all of NDIS participants. The pledge was that we would have vaccines delivered in their homes, and that's obviously the best way to do this. It's the kindest way to do it. It's the way that would be most acceptable for our residents, and they'd be surrounded by people that they know and they trust. We were told in February that we were part of 1A, and that was really excellent news for us. We went out and we got all of the consent forms signed, and we spoke to our residents, and we got prepared for nursing staff to come in to deliver the vaccines. We were told at that time that it had been outsourced to Aspen Medical and to Healthcare Australia, I think. And that they would be the outsourced group of nurses coming into the homes. And we've been waiting since February to have any contact about it. So at this point, we actually have a little bit more group homes than you said. We've got under 60 group homes in ACT, in Southeast Queensland, in Victoria and in Tasmania. We have not received any correspondence for any home for any resident to receive a vaccine in their home.
I think a lot of people watching this interview would be pretty outraged by that. Obviously, you must have been demanding answers. Who are you going to? What is the communication channel open to you on this front?
I think most of the advocacy has been done by our peak body, by National Disability Services, and they have been representing the sector and seeking the answers. We don't have a direct line to Federal Health to have these discussions. We have been having discussions with some state health as to whether they might be able to assist us. During COVID itself, I have to say the state health here in Victoria in particular, which was my lived experience of COVID, state health was superb. They came to every single group home. They came, they provided infection control training. They taught us how to don and doff PPE. They were very familiar with our residents. Our residents are community members living in suburban residences, and they use their GPs and their local health services, whether it's hospital or community. So ideally, from my perspective, it would have been ideal if that situation could have continued and that the state could have delivered the vaccines to this very, very vulnerable group. That hasn't been the path that's been chosen. And here we are, and it's middle of May. And as I said, we've not had one single resident offered a vaccine. Some residents we have been able to get a very small number of residents to their GPs. My own experience of that was my GP actually didn't get their vaccines until this week. So I went to a vaccination hub to get my vaccine. Having been through the vaccination hub, which was really efficient, it was fabulous. Well done, Cranbourne, that's where I went. it's probably not an ideal situation for this very vulnerable group to go there. A lot of it is administrative. It takes just as long, much longer, should I say, to do the paperwork, to go through the consent, to go through all of the administration processes before you get the vaccination. That takes a matter of seconds. So to take a very vulnerable group of people to a centre where you're really going to have to queue, even if it's done very, very efficiently and you're in and out in 40 minutes, it's still an impost, I think, on the centre, and it would be difficult for our clients.
You mentioned it's frustrating, it's disappointing. Is it also a bit baffling to you at this point that we're in this situation? I mean, you're a CEO, you're used to running a number of programs, no doubt. Have you been surprised at what is, I guess, mismanagement of this program?
I think where we are today is a real surprise. I was very concerned to hear that they had prioritised aged care over disability, and that has now been stated. I don't believe it's an either-or situation. When you triage for risk, people with disabilities living in group situations and aged care were both risk stratified at the same level. So they both came out with an equal risk rating. They've then been not equitably treated from that point on. We've had over 300,000 aged care residents vaccinated, and that's fabulous. Well done. I don't believe we should have had a situation where we had to complete the vaccinations of one group of vulnerable people before you started on the next. The numbers, as I say, in SIL properties, in group homes, is only 25,000. It is a fraction of what is there in aged care. This could have been a parallel process. And I think from a logistics supply perspective, if you think of especially rural, regional and remote, if you're going to take a supply chain out of vaccinations and of nursing to specific geographic sites, you would obviously do the vaccinations in aged care and in the group homes that are in those geographic areas. I don't understand why we've taken an approach that you do one and then the next. They were both risk rated at the same level of high risk. We also know that from Britain, we don't have the stats from America yet, but in Britain, 60% of all of the deaths, people had a disability. The statistics coming out of some countries are horrific. In Australia, we've done a brilliant job here. Very glad to be living in this bit of the world. But we can't deny that people with disability are in a very high risk category. The providers and everybody has done everything they can to wrap around people with disabilities to keep them safe during this time, and we need to continue to do that.
You mentioned that you got all of the paperwork in order early on in terms of getting people's approval to be given the vaccine. Have you come across a lot of vaccine hesitancy among your clients and also among your workforce, or are people desperate to get the jab?
It's a bit mixed. I think we would have to say, in all honesty, it's a bit mixed. Amongst clients, we have had very little vaccine hesitancy. We've had some clients who, when they've talked with their families or with their GPs, it's been considered that perhaps it's not what should happen right now, but those have been very, very small numbers indeed. We've got some clients who say, I want the vaccine and I want it right now, and why can't I get it right now? Among staff, we have done everything we can to encourage our staff to go and get the vaccine.
Does it need to be mandatory, do you think, for people working with those with disabilities?
Well, the government has taken a stance that it is not mandatory. So my sense is that we really need to adhere to that at this point in time. I can see that internationally there has been some movement in some countries, with some very vulnerable populations where it has become a requirement. I don't know that will happen in Australia. It's unlikely to happen in Australia, I suspect, with choice and control here. But I want to ensure that all of our clients have safe living conditions, and I want to ensure that all of our staff have safe working conditions. So for that, we're really, really encouraging all of our staff to get the vaccination.
Kate MacRae from Able Australia, we do appreciate you taking the time to speak with us. And look, I think we all hope that the Prime Minister will carry through on that pledge yesterday to pick up the pace, particularly in your sector. Thank you so much for your time.
Thank you.
Thank you so much for your time.
Thank you.